15 million Americans have surgery each year. Now, while most of the credit goes to the surgeons, it also goes to the team who assist them with the surgery before, after, and during the surgery. Now, part of this team are operating room technicians, and their job is to maintain as well as work with and deal with the tools and technology involved before the surgery, after the surgery, and during the surgery. They also assist the surgeon with keeping up with their patients, both before, during, and after the surgery. They're also known as surgical technicians or surgical technologists. And for my mentorship, I job shadowed a operating room technician at the Huntington Beach Hospital near Edison High School. My mentor's name is Selena Ogala, and the majority of my internship was done with her both in person as well as online. However, due to COVID restrictions as well as the health concerns of patients, the majority of my project was done online. However, I did keep close communication with her, and I also met with her in person. When I met with her in person, we spent a total of 1 hour and 30 minutes together, and she showed me around the hospital, including the rooms that the patient is in before, during, and after the surgery, and the types of equipment that is located in each room. She also showed me the instruments as well as the equipment and tools and technologies that are needed both before, during, and after the surgery, and how to gather them and help assist the surgeon using these instruments. And she told me that depending on the hospital, these materials can be located in different areas. As you can see from these photos up here, all the equipment and instruments are located in either cabinets or shelves, and this can vary depending on the hospital. So aside from showing me these in person, she also told me to find where these materials can be kept in other hospitals, and she also showed me her daily duties, her procedures, and what her daily routine consists of when she first comes inside the hospital, as well as what she does during her time at the hospital and when she leaves. She also showed me the duties and the job description and requirements, as well as the skills that you need to become a operating room technician, as well as the skills you will learn over time at your job. Now, she showed me around not only the rooms and the tools and equipment, but she also showed me other stuff such as specifically the job description. And what the job description includes is what the job is really about, and it goes into detail. This job description and evaluation form that is shown up here is specific to Huntington Beach Hospital, so this is not information that can be easily found online, and therefore it is super precious and super valuable in learning about the job of an operating room technician. And she also showed me other things such as specific procedures that she has to prepare for. And one of the most common surgeries is incision and drainage, which is the removal of abscesses, which are just inflamed skin and collections of pus that can be found over the body. And she showed me the procedure that she has to do when preparing for these types of surgeries, such as gathering the materials according to the doctor's preference card, which I learned is a card that basically tells the operating room technician the doctor's preferences about the surgery, such as their glove size, their gown size, as well as the materials that are going to be needed during the surgery, and what she has to do to prepare the patient for the surgeon to perform the surgery on. She also needs to perform the preparation of getting the materials that the surgeon will need, as well as preparing them inside the operating room, which is where the surgery takes place, for the surgeon when they come inside the room. And this was all done in person, and for my online work and portion of the internship, I watched videos. As you can see from here, here's an example of a video that I've watched, and here are some notes that I've taken for this video. I also looked at many photos and many websites that described what the skills of an operating room technician really encompass, and I also looked up many websites that showed me the the more specifics of the job, such as how they need to prepare for different surgeries depending on the location of the body, whether that's on their upper body or their lower body or their arm or the leg. And I also made some collages of the photos I found, as well as some presentations or some slideshows that show my learning and my research collectively, as well as the photos I have kept over my internship learning. And during my online work of my internship, I kept close communication and contact with my mentor, and she described any specific details that I didn't understand, or any procedures or medical terms I didn't understand as well. She also gave me a list of some of the most commonly used equipment during these surgeries, and this allowed me to look them up and see what they're used for and what their purpose is. Overall, the operating room technicians have an important job of maintaining and dealing with the tools and technology during the surgery, before the surgery, and after surgery, as well as taking care of the patient with these technologies and helping the surgeon overall. And I've learned very much from my mentorship, and I hope to use these skills in the future at my future job.